This is Jen and Ikena on eyesurgeontalks. I wanted to talk about children's eye health. Now, I've referenced this in a number of videos in the past, in particular in relation to short sight, myopia, because that's a topic dear to my heart, being a retinal surgeon. But specifically about children's eye health, it's very common that we get patients coming to clinic, or parents bringing their children in, who didn't have any idea that their child wasn't seeing very well. And sometimes these kids come in and they're maybe 6 or 8 or 10 years old and they've never been to an optician's. In the UK, we have vision screening programs in schools, which are usually carried out around sort of reception age. But if your child's not in school that day, they obviously don't get screened, or for example, everything might be fine at that age, but in a year or two, things may change and you may not know. And I think it's sort of difficult. There's not really much advice out there. There's not really much guidance for parents regarding what should be done for their children's eyes to make sure that they're working well, to screen them for any problems. Thankfully, children's eye health, tends to be good. Children have good vision. The eyes are generally working well. The most common problems you get in childhood are things like squint, so where the eye is turning in or out, and also a lot of sort of allergic and eye surface disease, which we manage in the eye clinics. But if your child doesn't have any of these and isn't under an eye clinic, I would always advise parents to take your child to an optician's, perhaps from the age of 3 or 4. It helps if they can read their letters. It helps them reading the eye chart, but if they can't, that's not a problem. Opticians are well equipped to test children's eyesight in various ways. But a quick check at the opticians doesn't take very long. It's going to be maybe 10 minutes for your child. It tends to be quite interesting for them, lots of interesting lights and pictures. And a quick screen like that can highlight any issues which might exist. And if all is well, that's great. You probably only need to get them checked again in another couple of years or so. If a test like that does turn up a problem, a glasses prescription, poor eyesight for an unknown reason, anything else, then it can be addressed. The issue with children is that if the eye doesn't have good vision at an early age, then it will never have good vision in the future unless you address the problem. Because the connections between the eye and the brain are forming during the first sort of 6 to 8 years of life. And if there's not very good visual input, especially from one of the eyes, then the brain isn't getting a nice picture from that eye, and it doesn't want to use that eye. It's not interested in that image, and the connection between the eye and the brain doesn't get stimulated. And even if you correct the vision later on with a pair of glasses, or for example, if they need a cataract operation or something like that, even if the focusing power of the eye is corrected, the eye never sees well after the age of about 6 or 8, if those connections to the brain haven't had a chance to form properly. And so early visual testing is quite important. I took my own child to an optician's when he was 3 because a colleague of mine, also an ophthalmologist, their child got picked up with quite significant amblyopia. So that's lazy eye. That's this lack of connections between the eye and the brain. And they didn't know anything about it. It was just sort of completely out of the blue. Their child was 4 years old, and so they started on a treatment regime, but they felt really bad that they obviously didn't realize that this was happening. And so I obviously also panicked, took my child to an optician's, and lo and behold, he needed quite a strong prescription here. He had some astigmatism that needed correction. Now, 6, 7 years on, he's got normal vision. But if we hadn't corrected it with glasses at that stage, he wouldn't have had. And so it's really important to get a regular vision check for your kid, even if you're not noticing any issues. And my other thing, I can't do a video about children's eye health without talking about myopia and short sight. But really, really important. There's a worldwide epidemic of short sight. Everyone's going into glasses. And, mild myopia, short sight is not such a big problem, but the higher your degree of myopia, the more problems you can run into. It increases your risks of retinal detachment, it increases your risk of cataract and glaucoma and other conditions. And so prevention of myopia progression is really important. So, short take-home message for your kids to stop them getting short-sighted is limit close work. So books, tablets, screens held as far away from the eyes as possible. Good lighting. Reading under your duvet at night with a flashlight is the worst thing, because you need really good light levels and it helps the eyes to not undergo the changes that lead to short sight. And outdoor time is independently protective for children's eyes against myopia. So sending them to play in the park, just being that outdoors is protective versus being in an indoor environment. Equally, screens further away, so a television screen as opposed to a tablet or a phone screen are better and more protective, although both are not great. That's my take-home message regarding children's eye health.